On October 16th, 2025, President Trump announced a game-changing federal deal with EMD Serrano. This is America's leading IVF drug provider. And through a new Trump RX program, 3 cornerstone fertility medications, Gono-F, Ovidrel, and Cetrotide, are going to be much cheaper when they're purchased bundled. Some medication packages will cost less than a third of their previous price. Now, we know that IVF remains one of the most expensive medical journeys in the entire United States of America, with cycles running from, $12,000 to $25K. And on top of that, the costs are like $5K for some of the drugs. And we know that financial barriers mean that a lot of Americans, nearly like 1 out of 10 of adults of reproductive age, cannot pursue IVF or must forego the multiple necessary cycles. And drug price reduction has an immediate effect, making fertility treatment more accessible, equitable, and less financially devastating. This initiative is paired with new federal guidance as well that is going to have employers offer fertility benefit plans similar to like a dental or vision coverage as supplements to insurance. Now, these benefit options could literally reshape how Americans pay for fertility care in the future. Now, procedural monitoring, anesthesia, and then embryo storage costs are still not going to be subject to this coverage, meaning that your out-of-pocket burden may still vary depending on your personal situation. But this sharp drop in IVF drug pricing is expected to drive up demand for IVF and fertility services nationwide. And hopefully reproductive planning is going to be a more inclusive reality for more individuals. Now, remember, the only drug costs are going to be covered, and the overall affordability of IVF is going to depend on broader insurance, benefit design, and other factors. But this is a step forward. Now, we know that disparities in access remain for uninsured, lower income, and also rural populations. So clinical teams are going to have to make sure that patients get the appropriate counseling about the risk, success rates, and also the required psychosocial supports that need to be put into place while going through the IVF process. So here's a few takeaways. The IVF medication costs are going to be dropping, and the doors are going to be opening for thousands and maybe even millions of families to access the care.